Hello everyone and welcome back. So we are going to discuss the topic pathology. The subject pathology. We will be studying this subject in short from first aid. Let's discuss briefly what is pathology. In pathology, we usually study the understanding of a disease and um, how the disease develop in different organ system, and also we study about the inflammation and disease and how it develop in different organ systems. Also we study the inflammation and cell injuries in pathology and how it leads to MI. Also the different types of neoplasias and how it develops. This is studied in pathology. What are the different kinds of neoplasias, which are esophageal cancer, colon cancer? All these are the main topics of pathology, that is cell injury, inflammation, neoplasia, and aging. So, we will be studying these things in pathology step by step. The first one that we are going to discuss is cell injury. Okay, what are the main things in pathology? That is cell injury, inflammation, neoplasias, and aging. The first one we will be discussing is cell injuries. Okay, so this is the topic cellular injury. Now, what is cellular adaptations? Cellular adaptations are reversible changes which can be physiologic. For example, uterine enlargement during pregnancy, or pathologic. For example, myocardial hypertrophy 2 degree to systemic hypertension. If stress is excessive or persistent, adaptations can progress to cell injury. For example, significant left ventricular hypertrophy, then which leads to MI and which leads to heart failure. Okay, so what we have studied, cellular adaptation. Cellular adaptation can be both reversible, that is physiologic, or irreversible, that is pathologic. Now, what are the examples of physiologic? These are uterine enlargement, which occur during pregnancy, or pathologic, which is myocardial hypertrophy, that is 2 degree to systemic hypertension. Whenever there is excessive systemic hypertension, it leads to heart failure. Now, what is the cycle? First of all, the excessive hypertension leads to cell injury. Then the cell injury leads to left ventricular hypertrophy as it is pushed to do its job again and again, and it leads to myocardial injury, and as a result, the myocardial injury leads to heart failure. Now, what is hypertrophy? It is the increased structural proteins and organelles that increase in size of the cells. For example, cardiac hypertrophy. Whenever an organ is pushed to do the excessive work, it leads to the hypertrophy or increase in number of cells, which leads to the enlargement of the organelles, which is called hypertrophy. And this leads to the enlargement of the cell. The example is cardiac hypertrophy. What is hyperplasia? It is the controlled proliferation of stem cells and differentiated cells. That is the increase in number of cells, for example, benign prostatic hyperplasia. Excessive stimulation, pathologic hyperplasia, endometrial hyperplasia, which may progress to dysplasia and cancer. Now, in hypertrophy, there is the increase of structural proteins and organelles, while in the hyperplasia, there is the controlled proliferation of stem cells and differentiated cells, that is, increase in the number of cells, which leads to hyperplasia. So when it occurs in benign prostatic hyperplasia. It is example of BPH. BPH is example of hyperplasia. Excessive stimulation, that is pathologic hyperplasia, for example, endometrial hyperplasia. Whenever there is the over activity of the endometrium, it leads to hyperplasia, which may progress to dysplasia and cancer. Whenever there is the excessive activity and of hyperplasia and it continues in the same rhythm, then it leads to dysplasia and cancer. Now, what is atrophy? That is the decrease in tissue's mass due to decrease in size. That is increased cytoskeleton degradation via uh, proteasome pathway and autophagy, that decrease protein synthesis, and or number of cells, that is apoptosis, that is the death of cells. These causes include disused innervation, loss of blood supply, loss of hormonal stimulation, and poor nutrition. Atrophy simply we can say that it is decrease in the tissue mass due to decrease in size. Now how it happens, it occurs due to the cytoskeleton degradation, that is autophagy occur here, the cells itself eat itself and the death occur, the size of protein decrease and the number of cells decrease, vice versa, that is apoptosis. So the causes include disuse and denervation. These are the causes of atrophy, that there is no nerve supply to the cells, there is no blood supply to the cells, there is no hormonal stimulation there, and also there is poor nutrition. These things leads to the atrophy of the cells, that is death of the cells. Now what is metaplasia? It is a reprogramming of stem cells, replacement of one cell type by another that can adapt to a new stressor. Okay, a normal cell is replaced by another cell, usually due to exposure to an irritant such as a gastric acid. Esophageal epithelium replaced by intestinal epithelium called Barrett esophagus. Okay, Barrett esophagus is the example of metaplasia. In metaplasia, what happens? The normal reprogramming of stem cells is replaced by another stem cells. Or tobacco smoke, that is respirated ciliated columnar epithelium is replaced by stratified squamous epithelium. This is the another example of metaplasia. These are important, okay, which may progress to dysplasia, that is malignant transformation with persistent insult. For example, Barrett esophagus, esophageal adenocarcinoma. Metaplasia of connective tissue can also occur. For example, myositis ossificans, the formation of bone within muscle after trauma. This is not a normal phenomena. Myositis ossificans is the formation of bone in the muscles after trauma. So, what is metaplasia? In metaplasia, the normal cells are replaced by abnormal cells for due to irritant or any gastric acid secretion or any other reasons. And the examples are the esophageal epithelium of intestine is replaced by intestinal epithelium, which is called Barrett esophagus, and another example is tobacco smoke, in which the respiratory ciliated columnar epithelium is replaced by stratified squamous epithelium. These are the examples of metaplasia. Now, what is dysplasia? Dysplasia is a disorder, precancerous epithelial cell growth, not considered a true adaptive response, characterized by loss of uniformity of cell size and shape, which is called pleomorphism. Pleomorphism means the loss of the shape of the cell. Loss of tissue orientation, nuclear changes, for example, increased nuclear cytoplasmic ratio and clumped chromatin. Mild and moderate dysplasia, that is, do not involve entire thickness of epithelium, may regress with alleviation of inciting cause. Severe dysplasia often become irreversible and progress to carcinoma in situ, usually preceded by persistent metaplasia or pathologic hyperplasia. Okay, so what is dysplasia? It is a disorder in which precancerous epithelial cell growth occur, and this is not usually a true adaptive response. Okay, in dysplasia, precancerous, not cancerous, precancerous epithelial cell growth occur, and in this case, not the entire thickness of epithelium occur, but there is some abnormality which is leading to the formation of abnormal cells. Okay, now this is the diagram which shows the hyperplasia. This is hyperplasia. Okay, as we have discussed, what is hyperplasia? It is a controlled proliferation of stem cells and differentiated cells in which there is the growth in the number of cells. So in here the number of cells has increased. This is hypertrophy, in which the cells become enlarged. You can see here these are the enlarged cells. Okay, this is hyperplasia. In hyperplasia, the number of cells increase. In hypertrophy, the cells becomes enlarged. In atrophy, the cells become decrease. There is decrease in the tissue mass due to decrease in size. Okay, irreversible injury, inability to adapt, irreversible injury and necrosis occur or apoptosis occur. These are the normal cells. Normal cells, when increase in number, it leads to hyperplasia. When increase in size, hypertrophy, and when decrease in size, it is atrophy. Now, what is dysplasia? there is change in the cell structure. Dysplasia, structure change. What is metaplasia? There is change in the cell type. These three are normal cells and this one is different cells. So metaplasia is change in the cell type. Now what is neoplasia? In neoplasia, there is change in the cell type and structure. The normal cell is this one. So here in the neoplasia, which are cancerous cells, there is change in both the cell type and structure. Both things are different. Okay, so in all these things, some are irreversible changes and some are reversible changes. Now atrophy is irreversible change. Okay, atrophy is irreversible. Now the dysplasia is irreversible, metaplasia is irreversible, and neoplasia is irreversible. While the hyperplasia, hypertrophy, and atrophy, these are reversible when normal cells occur in this form. Okay, in this diagram, the red mark shows irreversible changes and the green mark shows reversible changes. So these are the common cell types and the abnormalities or pathologies in it, the cellular injury. Okay. Um,